Hi, my name is Christina. I'm here to assess you.
Hi.
Do I have your permission to record this session and put it on YouTube?
Yes.
Great, thank you. What is your first and last name?
CP.
And your date of birth?
7/16/94.
And today's date?
11/20/21.
Great. And can you tell me what brings you into the office today?
So I've had a sore throat for about a week, and there's soreness while swallowing. And I've noticed my voice has been muffled, kind of like a deeper voice for the past week.
Okay, so started about a week ago. Sore throat, cough. Does anything make it better or worse?
I've been doing hot tea and honey, and I take cough medicine to help me sleep at night so I'm not up coughing.
Okay, but still no improvement over the
No.
last week. All right, so we'll take a look at everything. We're going to do an exam from your neck up, if that's okay.
Okay.
So I'm going to start just by looking at you. Everything looks symmetric. You don't look to be in pain. I'm going to take a feel. Your hair looks healthy. I don't see any bald patches. I'm going to take a closer look here. Okay, feeling for any contour irregularities, any hematomas, lumps, bumps, depressions. Everything feels healthy. And then I'm going to take a look at the face. It's symmetric. Nothing is standing out to me. Your eyes are, there's no nystagmus, no ptosis, no exophthalmos. My hands are freshly washed, so I'm going to take a look at your conjunctiva. Pink, moist. Again, no exudate coming from the eyes. Any issues with your vision?
No.
Okay, so I'm going to dim the lights, and I'm going to take out my ophthalmoscope, and I'm going to take a look here. Okay, I'm going to get a little closer to you. So we're going to go right eye to right eye here. I'm going to brace my fingers on your face. Okay, so we see the optic disc with a sharp edge. We see the vessels in there, no AV nicking. And we have a ratio of 1 to 3. And then I'm going to take a look at your left eye. Just look straight ahead. Okay, good. Okay, I can see the optic disc in there, sharp edges, ratio of 1 to 3. We see the vessels, no AV nicking noted, and no exudate or any kind of irritation coming from the eyes. The sclera is white. Okay, so do you wear glasses?
No.
Okay, I have our little mini Snellen chart here. So I'm going to turn the lights back on, and then I'm going to put this 6 feet away, and if you could cover your right eye and read the smallest line that you can for me.
Okay. LTF-PH.
Great. If you could cover the other eye and read that again, the smallest line.
LTF-PH.
Perfect. So you have 20/20 vision. Okay. So now we are going to move on to your ears. I'm going to take a look on the outside. I don't see any irritation, no erythema. All right, I'm going to take a look at the other one. Okay, looks good. I'm going to get out my otoscope. Just switch this quickly. Okay, and I'm going to hold it like this. I'm going to scoot a little closer to you. Perfect. And I put on a fresh sheath over this. I'm going to take a look in the ear. Okay. No irritation in the ear canal. We see the tympanic membrane. It's gray, it's pearly. The cone of light is in the 7 o'clock position. Perfect. And no, very little cerumen in the ear canal. We're going to take a look at the other one. I'm just gonna brace my hand here. Okay. Again, no irritation in the ear canal. We see the tympanic membrane, gray, pearly, intact. We see the cone of light in the 5 o'clock position, and very little cerumen in there. Okay. All right, so I'm going to do something called the whisper test, where I'm gonna stand behind you. I'm gonna whisper a word, and then I'd like you to repeat it out loud.
Okay.
Okay? All right, you can just stay seated right there.
11.
Yeah, we're gonna test on this side.
Banana.
Yep, perfect. Okay. Okay, and then I'm gonna take out my tuning fork. So I'm gonna make a dinging sound, and I'm gonna place it right on top of your head, and you're gonna tell me if the sound is equal in both ears, or if it sounds louder in one ear as opposed to the other. This is called the Weber test. Does it sound equal to you?
Yes.
Perfect. Okay, and now we're going to do something called the Rhine test. We're going to make it ding again. I'm going to place it behind your ear, and you're going to tell me when you stop hearing it ringing, okay? Did it stop?
No, it stopped.
Do you hear it again?
Mm-hmm.
Tell me when it stops again.
Stop.
Good. Okay, we're going to do it for the other ear.
Stop.
You hear it again? Okay. And tell me when it stops again.
Stop.
Okay, perfect. And you're hearing that longer when it's conducted through air as opposed to bone, which is totally healthy. Okay. So now we're going to take a look at your nose. Any breathing problems that are coming
No.
along with the cough? No? Okay, good. I'm going to take this scope again. I'm going to put on a clean sheath. And I'm just going to take a look up there. I'm going to just brace my fingers on your head. Okay, so there's no erythema, no edema, no turbulence. Take a look in the other nostril. Okay, again, no edema, erythema, no discharge coming from her nose on either side. Okay, doesn't appear she has any turbulence or issues with breathing. Okay. I actually do a few more tests for your eyes if you don't mind. I'm going to turn the lights back down again. And I have this light here. You're going to look straight ahead and I'm going to shine it towards your eyes. Just let me know if it's uncomfortable.
Okay.
Okay. So her left eye, her pupil is constricting when I shine the light in it. Her right eye is also constricting. Now I'm going to have you put a hand right down the center of your face like this. Perfect. Okay, shining my light again, and her right eye is reacting as we shine the light in her left eye. Good. And that is consensual pupil restriction. Again, I'm shining the light in her right eye and her left eye is constricting. Okay, you can lower your hands. Now we're going to test your peripheral vision. So if you can tell me when you see my hands come into vision, okay? All right, so we're going to test her left side here.
See it?
Good. And we're going to test her right side.
I see it.
Good. And now we're going to do them both together.
See it.
Okay, good. Equal on both sides. Perfect. I am going to test a few of your cranial nerves by having you follow my pen around.
Okay.
Well, first we're going to do convergence. Good. Perfect. And now I'm going to have you look up, down, to the left, to the right. Perfect. And then we'll do diagonally. Okay, so that tests the ocular, the trochlear, and the abducens. Those have been tested, totally normal and healthy. Okay. Going back to your nose, I am going to have you cover one nostril and take a breath in and out. Good. No issues with breathing. We'll test the other side. Good. And when I was observing, I saw that your septum appears very straight. It's good. And then I'm going to have you smell this alcohol swab. So if you want to cover one nostril and take a smell in. You smell the alcohol, right? Okay,
yes.
And then we'll have you test the other nostril. Okay, perfect. All right, and now I'm going to take a look at your sinuses. So I'm going to test your frontal sinuses first. Any tenderness when I press there? No? Okay, I'm going to test the maxilla. Sinuses, any tenderness? Perfect. Okay, now I'm going to check around your mouth. Your lips are pink, moist, no dryness, anything like that. I am going to have you open. Good, I'm going to take a look around. Your teeth are intact and healthy. I'm going to have you stick your tongue out and say, ah. Okay, I'm going to shine my light in there. So I do see that your throat is a little red, a little edematous. Your tonsils are a little swollen. There's some white exudate on them. I would say that they're about a 2+. They are a little enlarged, your tonsils. And you're having the pain on swallowing and the cough, so that makes sense. No postnasal drip, don't do anything dripping down from the nose. So we had you say, ah. I'm gonna take my tongue depressor and I'm gonna have you stick your tongue out. I'm gonna test your gag reflex. Okay, perfect. Okay. So I'm gonna feel your lymph nodes now, if that's okay. So I'm gonna feel pre-auricular, okay, not feeling anything. Post-auricular, no, don't feel anything. Gonna come down here, submental. Nope, still not feeling anything. Your anterior cervical lymph nodes, nothing. Clavicular, no, don't feel any. Posterior cervical and occipital, nope, no enlarged lymph nodes, that's good. Okay, we're gonna test a few more of your cranial nerves by having you do a few different things. I'm gonna have you raise your shoulders up against my hands, good, and relax. I'm gonna have you flex your neck forward and then hyperextend it back. Perfect. I'm gonna have you turn to your left and then turn to your right. And I'm gonna have you do that again while I press against you the opposite way, so turn into my hand. Good, and then we'll have you turn the other way. Good. Okay, and I'm gonna have you turn your head side to side like this. Perfect. Any pain with any of these movements?
No.
Okay, good, perfect. All right. Your skin is intact. No signs of infections, rashes, lesions. Do you have any questions for me while we're doing our assessment?
No.
Okay. All right. All right. I believe that concludes our assessment. Thank you so much.
Thank you.
And we will get you some prescriptions. We'll get you on track, okay?
Thank you.
Okay.